ARC for this opportunity. So I'm going to be talking on academic evolvement going forward. So let me start with my journey. I did my post-graduation from KEM Mumbai, which is in around 2000 year, where when I finished my fellowship, I was doing topical phacos, and it was comfortable. But at that time, I went for a contactless course to LV Prasad, and I got really floored by the place, and I said, yes, I have to do a fellowship there. And the reason why I decided to do a fellowship, because I wanted to look at academics. So my friends kept asking me, you can start a private practice in Mumbai, you know how to do topicals, what is the need to go? But the reason I felt that even surgically, if I was too sound, there's something missing, and I had to go to this place. So what is academics for me? Knowledge, presentations, publications, training, and communication. And these are the 5 important things which I did not get much exposure during my PG. And I think these are something which, as a student, you all need to know, and I'll take you through each of them. So starting first with knowledge. You don't know what you don't know until you know it. And this is the major goal of any fellowship. And this is what I realized when I went to LVP. I thought I knew everything. I'm doing topical. What's the big deal? But a lot of clinical skills we don't know. And more so in medical colleges, we are deprived of those opportunities. So with that, that's the first goal. Second is golden opportunity to study during your fellowship. Read books, journals, recorded webinars. Now we have an access to all that. And look for evidence-based medicine. That is very important. Because you need to understand that the eye sees what the mind knows. And if you don't know something, you'll not be able to actually figure out what to see in a patient. And let me tell you, during your fellowship, you can read a lot. Once you are done from that place, you'll never open a book unless you have a presentation like this or you have to really present. So take the opportunity, read as much as you can. During your fellowship, watch your teacher examine, counsel, and treat. Discuss normal cases, difficult cases at the end of the day. That's important. Imitate your teacher and learn what to do. But sometimes you should also learn what not to do. So don't always look at the teacher in all aspects. And as a trainer, we have to realize that the fellow who's come is like our child. And we need to really help him grow just like what we are. And that's something which, as trainers, we should do. But at the bottom line, we should know, even if we are ophthalmologists, we should finally aim to be a good human being. The other important aspect is mentor and mentee program, which helps us to improvise on our ability, capability, and helps the fellow sail through very easily. Just like the mentor can evaluate the fellow, we should also have the opportunity for the mentee to evaluate us so that we become better teachers in all aspects. It's the clinical, discuss with the case with your student of how did you do it, your surgical skills, and then it helps us to grow. We cannot assume that we are the best. Many a time, they would have read a little better than what we have discussed with it. So that is how a mentor-mentee program could do. Other important aspects is, yes, trying to get on the social media. There are a lot of groups available. We can discuss more so once you've finished your fellowship. You can discuss and get opinions, learn, to stay in touch with the latest news that's happening, the treatment options available, and meetings. Like, for example, I'm KM alumni, so I'm a part of that group, the LVP Pediatric Alumni Group, and then other groups where we are a part of the pediatric ophthalmology. In the end, you should also think from your knowledge what specific you can do. Something will make you different, like you can choose ROP, you can choose pediatric cataract, you can do strabismus, and as discussed earlier, pediatric ophthalmology with CVI. You can also have myopia, which is now the new kid on the block. And finally, pediatric genetics. So there's so much there, much more than. So in addition to what you do, try to have a niche area, and that will help you grow further. Presentations. The other thing is, during your fellowship, start with case discussions. Difficult cases, how do you diagnose, management options, surgeries, and have a very good documentation, because that can be your first publication by writing a case report. Like, for example, this 6-year-old child, CKD, came and had these classical disc features, which were of a papillorenal syndrome. As I said earlier, if you have not read it, you would not think of it. So it's important that you have read it, and then you can put it as a publication in your journal. Then have more journal clubs, didactic lectures with your mentor. It should be more interactive. Sit with them and learn how to do, because eventually you may have opportunities to present. Newer technologies you should learn, like using the slit lamp photography with your phone, because you may not be able to get an access once you leave a particular institute. The 9-gaze photography apps, which are user-friendly and available. So all of us have, but if you are known to it, you comfortable with it, you can start doing it once you're in your practice and out of this place. Then focus on studies, which is important. Maintain Excel sheets of your squints, cataract cases, morphology and surgical outcomes, etc. Research projects should be there, like in pediatric cataract, myopia, multiple things you can choose what you like. Focus should be on good scientific content. Also, you can beautify your presentation as well to add value to it, especially when you go to present in your conferences. There are so many options of animations, transitions, ready-made templates, tool in PowerPoint, or even Prezi. So all this you can make so that among your counterparts, you can actually stand apart. So this is something which you can do as a fellow, learn all these aspects also. As a part of fellowship program in an institute and for regular classes and meeting, you should have, like in NN, we have our regular classes, we have conferences, so try to present during that. Be member of all societies. So like local society, I'm from Bangalore, so take it from BOS, then our state society, so KOS. And since I'm from Mumbai, so I would also be a part of BOA and MOS. So wherever you have an opportunity, please try to present at those places. Then obviously national conferences, that is AIOS. Then specialty conferences, where we have SPOCI and POSN, which is a new one, where we have all case presentations and all discussed. Then WSPOs and APOs, these are international ones, but there's so much good opportunity to present, so don't miss those. So that you can present your work either as oral papers, posters, there are so many options like physical, poster podium, and videos, and ensure to give exit exam. Now, incidentally, in Narayan Nethralaya, we have the Rajiv Gandhi University exam because they are affiliated to this university. But in other places also you can give FICO, that will make you stand apart and help you learn more, because sometimes all the fellowships may not have exit exams. Then coming to the other aspect, publications, at least one case report or case series is what you should aim for. Observational and interventional series like retrospective, cross-sectional, etc. Be a part of prospective studies and try to aim for RCTs, because this opportunity you will get at your institute. Be a part of reviewing articles. So your teacher and mentor may have these articles to review, do it with them, try to do independently so you learn the knack of writing papers and reviewing them as well. Then also you need to publish in your local and state society conference, like for us it's KOS, the Journal of Visual Sciences. Then renowned journals like DOS Times, which are read by all. And then our own AIOS official journal like IGO. More so because there are so many options in IGO like case reports, photo assays, OMO. So these are things which you can start with and eventually have reviews and write up for your mentor, with your mentor, and then you can be independent. You can also look at high impact journals like IOVS, ophthalmology, and specialty journals like for our specialty like pediatric ophthalmology and strabismus as mentioned here. Have targets at the end of your fellowship. At least one case report in peer review journals like IGO and JAPOS, retrospective studies in state societies, then national and international level, and one research project, so that at the end you are tuned to how you can go about and starting doing the same in your practice. Then the other important aspect is training. That will help train to go. So basically teach your junior fellows and postgraduates. You should take classes for them, lectures, part of workshops, teach in clinics and after routine hours. But in addition, when you're doing it, it should be done under supervision. That is somebody watching you do it, not just as a senior fellow. And then when you're competent enough, just before you're exiting, you can do it independently. Even when it comes to surgical, one surgery assisting is important. These are my fellows going for surgery. So what I tend to do is, once a fellow has become senior, he would assist, which is normally done, but that will be still done under my supervision because I'm assisting my senior fellow to see whether she's assisting well. Then since that's because if it's not the operating surgeon, there's relative peace of mind and complication can be handled easier, taken decisions properly and managing better. So this is another fellow of mine operating, and I'm happy that this went off perfectly. And the final part is communication, which is important, how to talk to your patient. Now for us, these patients are children, so basically how to handle them. So talking to the parents to explain the problem and also the treatment helps building a good rapport, and that is very important for us as pediatric ophthalmologists. In that way, we also learn to handle unhappy parents. But very important, ask the question why when you see a particular patient. Like what the 62-year-old female came with gradual constriction of vision, underwent cataract surgery for the same problem, but this constriction did not go. She had both eyes pseudophakia with normal retina. So important, as we repeatedly say, history is very, very important. So this patient had actually cancer and had got treated. So this is very classically cancer-associated retinopathy. So if you would not have known it and you would have not taken a good history, you would have missed it. And the diagnosis is done by using an ERG. Then the other aspect of communication is right counseling and treatment goals. For example, a third nerve palsy complete. You can see no elevation, no depression in the right eye, and no adduction. All was abduction. So you need to explain to the patient what exactly is going to happen, how many surgeries are needed, so he's very clear and what he can expect and how much surgical surgeries may be needed. However, remember in our specialty, never give up because there's always a rehabilitation available. The other thing is in pediatric ophthalmology, look at the child as a whole. It could be a part of systemic disease and syndromes like Gaucher's disease, mucopolysaccharidosis, so you need to know that. And more importantly, a good coordination with other specialties like pediatrics, clinical geneticists, neurologists is a must. So finally, to end with, that fellowship is not an easy task. You will have some people throwing stones in your path. It depends on what you want to do it, build a wall or a bridge. Remember, you are the architect of your own life. Be thankful of what you get and make the best out of it because this is a fellowship and very few people get it. So enjoy your fellowship journey and have a wonderful life. Thank you very much.
Thank you, Dr. Jyoti. We just have a couple of more minutes. So just to diversify the information, Dr. Ramesh, LVP experience, any comments on how a good fellowship program can be kind of implemented?
I think one of the, is it audible?
No.
Am I audible?
Started.
It's on. Anyway, I think for our field of pediatric ophthalmology and neuro-ophthalmology, three things stand out is setup of GA. Many people are still not satisfied with the cataract surgery. And the third and the most important thing is revenue. These are the three things people think about it. So in terms of demand and the requirement, I think a lot of things are there. But what I have seen, what we have seen, personally I have seen training close to 75 fellows, is that the attitude and aptitude is the most important. It's not that they should be, very intelligent. Ultimately what happens is their interest, their perseverance makes them the best. It's not that where do they come from, but we can train them if they have good interest. That's what we have seen. But somehow as a country, I think we need to look at how to improve these things which are not there. Because many fellows still they want to be successful in cataract surgery as well. This is one of the most important thing.
It's unfortunate the way the society is actually, and everybody comes from society, so there's nothing we can actually stop the commercialization of all this. Dr. Mahesh, anything on running a very successful and a very good neuro-ophthalmology?
So in our institute, we don't combine strabismus and neuro-ophthalmology, so I'll be able to speak only on neuro-ophthalmology. And we offer 3 months program only, short-term training. And one of the aspects which we have found is very helpful is we always rotate them in other related specialties like orbit, which are closely related, as well as ortho-optics and pediatric ophthalmology for about a week each. And integration of all these specialties, even though it is short term, it is really helpful for them. And of course, they don't operate in these 3 months because it's a short term. They focus exclusively on neuro-ophthalmology.
You don't have issues or problems in getting interested candidates?
No, we don't have. We have we don't have much because it's 3 months.
True.
Okay. So
Yeah.
that is
For 3 months.
that is a catch.
Yeah.
So,
Now, Ambika, a couple of words before I'll invite Dr. Vidya to start the next session.
I think we have problem because it's about 18 months
Yeah.
and it's general ophthalmology with neuro-ophthalmology without any surgical specialty. Dr. Sujata was mentioning that you will have a feel-good factor at the end of the day when you finish a clinical practice of neuro-ophthalmology. That's only a feel-good factor because if it is not going to be a surgical specialty, definitely the takers are less. And in fact, we have a very good network of neurology, neurosurgery, radiology, ID, and we also have an emergency postings along with this. And we have a neurooptometry rehab program also, which is also inculcated in the fellowships. So I think it is not only in India we have this difficulty of finding a flair for the specialty. In fact, Dr. Clementine was asking, how do you get fellows for neuro-ophthalmology in India? Because it's a global problem.
I guess, true.
But I think as the specialty is so good, it doesn't matter if we don't get too many people. I mean, it's good if we get very condensed number of really interested people. So I think
True, but
have
but
a
anyway,
fellow-
let's hope this changes. I mean, some good news to share, of course, before we invite the OP people. FICO has started neuro-ophthalmology. Unfortunately, only one person appeared for it last time, and so we had an issue. This time, we will try and push AIOS to actually make it, kind of advertise it enough so that more people apply for it. So there is now a FICO certification that is there, so people can get certified. So people who are, even short-term fellow trained, who do not get any, any major certificate to boast of as being good, well experienced in neuro-ophthalmology, can appear for the FICO exam and get a proper certification. And of course, FICO is now getting better and better. Dr. Grover shared the idea that probably it's going to kind of mix with international programs and probably create benchmarks internationally. So that would be very, very good from an academic standpoint. Like I said, we have now started neuro-ophthalmology FICO, which is, after a long struggle, we managed to get that. I think it's great. And again, the program is now well designed and very clear. So over, I think, next few years, we may probably start getting more people interested in this specialty. So thank you very much. Thank you, everybody, for